Well, for those that don't know me, obviously, my name is Victor Maertens from EUCOPE, and you've heard me speak already for a few minutes today, but I'll try to keep this short, as I think a lot of the kind of the key reflections we've already heard from the other colleagues. But I want to just take a step back as well and look at kind of what Europe has done well as well from our perspective over the last few years, and obviously with a number of key pieces of legislation coming up over the coming months and years, where we see an opportunity for the EU to take that role to address some of the challenges that Friedrich and Adam mentioned, to make sure that Europe does stay an attractive place for investment from cell and gene therapies. And although I think we've been critical of a few points on what the EU has been experiencing, I think there's also a few very important elements I just want to point out, and Friedrich mentioned a number of these. And I think first and foremost, I just want to start by saying the fact that we've got the EMA has been an incredibly important asset for Europe, making sure that we've got a body driven by scientific excellence, and that's been able to adjust and be flexible to reflect the changing realities of technological innovation, to make sure that these therapies can come to market and can make their way to patients as well. The fact that we've had a robust and predictable regulatory system has obviously been fundamental to ensuring that industry can take on those long-term investments to develop therapy and to overcome some of the challenges that Adam mentioned as well, about making sure that some of that risk is hedged. And then again, as Friedrich mentioned, we have seen a number of ATMPs launched in Europe first before anywhere else in the world. Some unfortunately have been withdrawn, but we've had at least, as of June, I believe this year, over 20 ATMPs already receiving positive opinions from the EMA since 2009. So we have seen quite a lot of progress and quite a lot of success in Europe as well. If we put that in the orphan space as well, obviously over 200 orphan therapies approved since the orphan regulation. And looking at that just kind of more generally, over 90 medicines are typically assessed and receive a positive opinion from the EMA on an annual basis. So I think there is a lot that we can see when it comes to that innovative potential here in Europe. And if we want to make sure we reinforce that and keep that moving in the right direction, I think it's important to recognize that I think Europe has done well over the last 20 years. Yes, there's still challenges that we face, and yes, there's still unique elements to ATMPs, but I think it's more refining what the system we have rather than looking at fully overthrowing that. Europe has some of the best academic centers in the world, I think has been remarked by some people as well, that help drive that forward. But I think one of the key challenges we see is how do we translate some of that knowledge, that expertise into therapies. And MEP mentioned that, MEP Vice mentioned that as well at the beginning. We need to make sure we've got that translational research in place. Some things that we need to consider in that regard, and I think McKinsey recently published a piece as well, is on indeed some of the challenges we face with clinical trials, with a number of those. I think 80% of all clinical trials in ATMP is taking place in the US and China, where Europe is falling behind a bit. We see that as well with where we look for sources of financing and where patents are filed, where Europe's slowly starting to fall behind as well. So those are key areas we can look at when we consider how we can make Europe more competitive. And when we talk about setting ourselves up for success, I think we need to reflect on the fact that I think it was a former FDA commissioner that reflected on the fact that 5 to 10 to 20 cell and gene therapies can be expected to be submitted to medicines agencies on an annual basis by the time 2025 rolls around. I think, obviously that's changed a bit with COVID, but I think that highlights the need for us to make sure we've got a future-proof system now before we're in a place where all these ATMPs come to market. And in 2002, the Commission had a life science strategy on biosciences, which said we were at a crossroads. We can either set policy that's leading the way, or we can follow. And I think much like then, we're in a very similar position. I think we're at a point where either Europe can set the stage, set the direction of travel, or we'll be in a bit of a following position. So I think that's, I'm keeping an eye on time as well. I've got about 15 minutes left. I want to leave some time for questions. I'll stop there, but I think we're really at that inflection point, and anything we do will have ripple effects. So we need to be very careful what we do to make sure that we keep a system in place that works now and in the future.